Because as a woman you want to wear nice lingerie and you want to feel glamorous and attractive, but you don't. A great big pad doesn't have the same effect. So dealing with incontinence is a bummer. But I thought I'd just leave the final word to this. I don't know if it's big enough. Can you read it? Okay. One of our questions, how would you rate life as a whole? Completely satisfied, 7.78% said yes. Mostly satisfied, 72% said yes. So that's 80% who are satisfied or mostly satisfied. That's okay, yeah? Neutral, 12%. Mostly dissatisfied, 5%. Completely dissatisfied, 2%. So 80% of the 90 people who responded to that question are satisfied or completely satisfied. And so that indicates to me that transition overall is going quite well. You know, it doesn't mean to say it cannot be improved. And just as a footnote, one group of people who find transition particularly difficult were the walkers. Because walkers, very often their gait is affected and they can be seen as drunk or under the influence of some sort, or maybe even intellectually impaired. They may also, they don't get the same sympathy as someone sitting in a wheelchair. They may also have problems with bladder and bowel control, and they're walking, and so that's really difficult too for them. And on that note, I want to finish. Thank you.
Thank you very much. It's a real privilege to be here, and I look forward to the other presentations that we're going to have later in the afternoon, and also to your feedback when we have a bit of a wider discussion after my presentation. I'm actually from Otago, although I'm actually retired, but I'm still, as you can see, doing a bit of work. So I'm going to talk about socioeconomic outcomes following spinal cord injury. See if I can work that. Okay, I think everything on this slide we've already talked about, so I'll go on to the next one. So when we originally got funding from the Health Research Council, we had two main aims. The first one was to explore the relationship between body, self and society for people living with spinal cord injury. And the second was to investigate how entitlement to rehabilitation and compensation affects socioeconomic and health outcomes. And actually I'm going to talk about socioeconomic outcomes rather than health outcomes, although there are a few health outcomes in what I'm going to present. Now, we've called this study a natural experiment because we're comparing people who've all had a spinal cord injury, but in a way it's an accident of fortune, which makes it sort of like an experiment, whether they end up in the group that gets ACC or not. So it depends on whether they have a traumatic injury, whether it's overseas or in New Zealand, or whether they have a disease process versus an injury. You can imagine in a real experiment, you randomise people to get ACC or to get Ministry health funding, and then the two groups should be exactly the same apart from chance that they might differ. In this case, of course, the people are a bit different. And one of the things we want to look at is how they differ and then try and adjust for that. So we can make that comparison. And of course, the reason as well we're interested in doing this is that I think it's been a long-standing sense of injustice in New Zealand society that people who have an injury get ACC and people who have some disease process get much less. So we were really the first people, we actually are the first people to actually investigate this injustice, if you like, and look at what it's made of, and therefore to think about what might be done about it. Right, okay. So this is about who's eligible and who's not eligible for ACC. So people who have a traumatic injury are eligible, and people also who have a treatment injury, so they may actually suffer a stroke through a treatment injury, they may well be eligible for ACC. That provides compensation, 80% of pre-injury income for those who in the job, sometimes lump sum payments, support services, home and vehicle modification. For those who don't get ACC, their spinal cord injury due to some non-traumatic disease process or an injury sustained outside New Zealand. And they receive the same in-unit rehabilitation, but afterwards their health services differ somewhat and their access to compensation is means-tested benefits. Which means that, in fact, if in a couple, two of them are working and one of them sustains a spinal cord injury, the other one will not get any compensation for their lost income, of course, unless they have private income insurance. Okay, so this is the second of the studies that we've done on this, looking at this comparison. So we actually did earlier a comparison of people who had an injury as part of the prospective outcomes of injury study who all got ACC, and we compared those to people throughout New Zealand in the same areas who'd had a stroke in the same age group up to 64. And we found that this just looked over 12 months, but the median income declined by 13% in the injury group and by 60% in the illness group. So there were these very major differences. That paper was published in Social Science and Medicine last year, actually, and Sue was the first author. In fact, Sue McCusker did her PhD on this topic. And we also found that return to work was higher in the injury group, and we were surprised about that because these were people who were getting earnings-related compensation and thought it might be the other way around, that if you didn't get earnings-related compensation, the push to get back to work would be stronger. But of course the other thing to think about is that these groups are a bit more different, an injury of a whole variety of different sorts of injury versus a stroke. So they also did have some differences. Right, okay. Now, to spinal units, you know about that. Recruitment, you know about this as well. Martin's already told you about that, so I'll just skip over it. And also he's talked about the process. Yes?
Were people with head injuries included or excluded?
People with head injuries.
Concurrently, yes.
So if they were able to take part in an interview, they were included, but not otherwise. Okay, so I've gone over the process, and I just want to, although we concentrated on 16 to 64, we actually collected information, or some basic information, on everybody who came into the spinal units. And one of the reasons for that was that we wanted to be able to calculate incidence rates. That's the new occurrences of spinal cord injury over a particular year. And you can see here that our estimated annual incidence was 30 per million, so it's rare. And that 30 per million, we looked at a whole lot of other studies that have been done across the world, and that's sort of somewhere in the middle in terms of different countries and their rates. When we looked at age-adjusted rates, of course, the populations are really different for Māori and Pacific and European New Zealanders, and we found that it was lower, was 29 per million, so that, as you expect, similar to the overall rate, higher amongst Māori, 46 per million per year, and particularly high amongst Pacific people at 70 per million per year. And for other ethnicities, including Asian, it was actually lower. Okay, but today, and we might come back to that. In fact, I'd like to come back to thinking about these very high rates amongst Pacific at the end. And that paper's been published. So today I'm going to talk about the group age 16 to 64. And again, we've already talked about those numbers. 118 participated in the first interview, 103 and 91. But this now, we're dividing people up into whether they got ACC or whether they didn't. And you can see 93 were covered by ACC and 25 were not covered by ACC. So that's pretty small numbers. And so we can only do some fairly big analyses and not very fine ones. Okay, so this shows you the basic data collection information that we collected. So we're interested in characteristics before spinal cord injury, which were of course collected afterwards at the first interview, about 4 months. The post-spinal cord injury characteristics, we're interested in the Asia impairment scale, general health status, I'm going to show you those. And outcomes here, I'm going to look at return to work and amongst those who are working at the time of their spinal cord injury, and some other measures, some measures of socioeconomic status, personal income, material standard of living, and household income adequacy. Okay, so this is now comparing the two groups. Remember, in a randomised trial, that these groups would be the same, but they're a bit different, actually. So with the pre-spinal cord injury characteristics, the only things that were different were the socio-demographic. Age. I think you'd be unsurprised that people who had disease process, the non-ACC group, were older. And actually they were more likely to be women. That is, I've got the numbers here. So 18% in the ACC group were women. It's overwhelmingly male issue for injury, but 40% were women in the disease, or the non-ACC group. But for the other things, there were no statistically significant differences between the two groups, which was very good for us. It meant we could make a better comparison between the two groups. Okay, so now I want to come on to some results. And I hope you probably can't see this terribly well, but I'll just take you through it. So one of the things that we wanted to know was, were the trajectories of recovery in terms of health status different between the two groups? So these graphs are really hard to read, partly because it's small, but more particularly because of the way they go. So these were, for the general health status, we used this thing called the EQ5D, and Sarah's international expert for New Zealand on the EQ5D, which stands for the... Oh, okay. Oh, I want to call it the Euroqual, but it's not anymore. Okay. And 5D must be 5 dimensions. And we added a 6th dimension. So you can see these dimensions. Sorry. Okay, no, that's not that. So you can see the dimensions are mobility, self-care, use of activities, pain, discomfort, anxiety, depression, and cognition. Now the cognition is the 6th one, and Sarah and her colleagues have worked out a way of making it another dimension, which is really important in this case. And the other thing I want you to notice is that the y-axis says proportion with any problems. So you can see, say, from mobility, that at the outset, at 6 months, actually most people had any problems. Nearly 100% had any problems. And the fact they're falling over time is a good thing. That's fewer people reporting any problems, just so that you don't think they're really odd. And you notice also this, it says 6 months, 18 months, and 30 months. And actually, Martin said 6 months, 12 months, and 24 months, which is what they're supposed to be. But actually, we looked at the mean time, interviews were actually held somewhat later than we hoped. So actually our mean times fit much better with it being 18 months and 30 months. So we actually go out to 2.5 years. And you can see that, again, very reassuringly, the two groups, so the red one, the blue one is the ACC group and the red one is the non-ACC group, that they show a very similar pattern except for cognition. And you can see that for cognition, the proportion with any problems goes on dropping for the ACC group, because some of those will have had head injuries, but it goes on dropping. Whereas for the non-ACC group, it actually increases in that last period. So obviously that's important for us to take into account when we're doing the analysis. It's very small numbers, yeah. Right, okay. Oh yes, that was supposed to show you that. I forget to do these things. Okay, so return to work. Now I'm going to show you the whole cohort. To begin with, so this is everybody with ACC or not ACC. Amongst those in paid employment before their spinal cord injury and followed to 18 months and then followed to 30 months, so you see the numbers, the proportions drop down. Return to work at 18 months, 42%, return to work by 30 months, 49%. Now, Sue and Sarah and I, Martin, looked at a whole lot of other papers. There's lots of work done on return to work, as I'm sure many of you are aware. And actually, this is quite good, this return to work is actually quite high compared with many studies overseas. Now, here's what we were particularly interested. Sorry, this is a rather busy slide. So this is return to work comparing people getting ACC and those not getting ACC. So by 18 months, quite similar actually, 42% of the ACC group and 39% of the non-ACC group had returned to work. And by 30 months, 49% of the ACC group and 29% of the non-ACC group had returned to work. Now, the one thing you might notice is there seemed to be more of the non-ACC group who returned to work at 18 months than at 30 months. So that will be a mixture of the fact there's slightly different people there, depending on who we got at the different times. But it's also partly that, as people know who've done much work in this area, people can go back to work and then they can not sustain it and move back out of the workplace. So again, we were surprised, but it's similar to our stroke and injury study, that actually people on ACC got back to work quicker. Now, of course, we wondered whether it was some other characteristics, the age or sex or cognition. So we did an adjusted relative risk, which is quite hard to interpret it, comparing the ACC and non-ACC groups. And even with our adjustment for age and sex and cognition, we found that the non-ACC groups were less likely to get back to work. But it wasn't statistically significant, and we can't hang our hat on that, because for those of you who are interested in these things, the 95% confidence limit were very wide. They went from 0.27 up to 1.24. Okay. This is return to work and ethnicity, and again, because of small numbers, we couldn't look more closely at this. Am I going too slowly or am I all right? Okay. Okay. So just to tell you that comparing our Māori Pacific population and non-Māori Pacific, very similar proportions were actually in work at the outset. 82% and 84%, practically the same. But at 18 months, fewer Māori Pacific were back at work, and also fewer back at work at 44 months compared with the non-Māori Pacific. Okay, so now we're on to the direct socioeconomic outcomes, and we asked about, one of the things we asked about was standard of living, and again, this is like the way around you don't expect. So this is the proportion who reported medium or low standard of living, and they were asked to say whether their standard of living was high, medium, fairly low, or low. And you can see that the blue groups, the ACC group, that they their standard of living, this is the medium-low proportion, actually didn't change much over that time. Got slightly worse, but in the middle period. But whereas the standard of living for the non-ACC group got worse to 18 months and then recovered a bit. The next question we asked was about household income adequacy, and the same sort of thing. They were asked whether there was more than enough, just enough, or not enough. And this combines just and not enough. And again, if there's an increase, then it means there's more who've got just or not enough, so more that are badly off. And you can see this is a slightly different picture and more extreme, but you can see that for the non-ACC group, quite a lot more had just or not enough at 18 months and sustained at 30 months. It was slightly worse for the ACC group, but these were statistically significant differences between the two groups. Then we looked at median personal income and not everybody gave us this, and again slightly different numbers over time depending on who we interviewed, but you can see this very graphic difference that the non-ACC group started off with a slightly lower median income, but it was not statistically significantly different. The ACC group, it stayed very, very, very static and actually went up a bit in the last period, but we sort of looked at that and we think it's partly slightly different people. So ACC group sustained their income, whereas for the non-ACC group, their income fell, so that by the end it was half the income of the ACC group. So that's the most striking finding and highly statistically significant. Okay, so to conclude about this, for the whole cohort, overall personal income, standard of living and adequacy of household income decreased slightly to 18 months and then stabilised to 30 months. This is for the whole cohort. The increase in return to work for those who were in paid employment was 42% by 18 months and 49% by 30 months. Return to work was lower amongst Māori and Pacific participants. Comparing groups, return to work rates were higher amongst the ACC group, although that was not statistically significant. Median income for the ACC group remained similar through to 30 months. Amongst the non-ACC group, median income fell to less than half of the ACC group, and the adjusted relative risk showed that a significantly lower proportion of the non-ACC group had not enough or just enough income at 30 months. The difference was less for material standard of living. Just to say something quickly about the strengths and weaknesses of our study, it was population-based, it was prospective with a relatively high response rate, and again, we've all, I think, looked at a lot of studies around the world, and often they're just cross-sectional, so you really can't tell what's going on, so it's really good design. It does underrepresent Māori and Pacific populations, and who have the highest incidence of spinal cord injury, and that was partly because fewer of them agreed to take part or were able to be found for the first interview, and also because fewer of them continued. And that small numbers precluded us exploring whether anything different was going on for Māori and Pacific with ACC and non-ACC. It also underrepresents those with most severe spinal cord injury at the final time period, not at the beginning. There were some differences between the two groups, but not very many, and we adjusted them in the analysis. But actually, we were also just interested, even if they were different, why should being sicker or having poorer cognition mean that you should end up on less income? You know, it's not obvious. It may be true that you'd be less likely to get back to work, and that would be completely understandable. Most people retain their pre-injury SCI. Reasons and return to work rates are relatively high. The reason for both the findings appears to be provision of no-fault compensation to most New Zealanders who sustain a spinal cord injury. It helps prevent a downward spiral to poverty where ill health leads to further declines. Such a no-fault compensation scheme should be seen as a model for rehabilitation after a spinal cord injury for all, both traumatic and non-traumatic, because that's what we'd like to see. And we think there should be further research to explore the effects of ACC on wider quality of life, and also to look to map at the qualitative findings with the quantitative findings to help understand exactly how ACC is affecting these outcomes. And we need to understand more about Pacific peoples in particular and spinal cord injury, both the reasons for the higher incidence and the outcomes. I'm going to stop there, almost like, but I think I will stop. But just to say that this paper has been published quite recently in Spinal Cord, and we actually do have some reprints of the paper if anybody would like to have one.